is Dr. Priyal Gala. I'm a consultant dermatologist and trichologist practicing in Mumbai. We are here to talk about one of the most common complaints of summer, the itchy scalp, the itchy and dry scalp. You'd be surprised to know that there are so many causes of itching of the scalp. There are 4 broad topics. One is the skin conditions which can cause itching. You can have neurological conditions. You can have systemic conditions. When I say systemic conditions, something's wrong with your kidney or your liver or your blood. And last but not the least is the psychiatric condition. So people who have very severe anxiety, depression can have itching of the scalp. Since I'm a dermatologist, let's just talk about the skin conditions. Now you must have heard of the word dandruff. Dandruff is one of the most common skin or scalp condition of the world. 1 to 3 people out of 100 suffer from dandruff. Now what is dandruff? In our language it is called pityriasis capitis. It means flaking of the skin. But it's just not pure flaking. Dandruff is an interplay between flaking, between the sebum or the oil production of the skin, your sensitivity and environmental conditions. So you would not notice fine flaking or the white flakes that fall on the shoulder, or it can be very sticky, thick flakes of the skin. Now, how do you treat this dandruff? What are the ways that you can keep this dandruff under control? Always remember, dandruff can become a scalp type. You might not get rid of it, but you can definitely keep it under control. The first and foremost, you have to clean your scalp regularly. If you have very thick, sticky, adherent flakes, you might have to do it daily or at least alternate days, especially in this hot and sweaty and humid summer. Choose the correct anti-dandruff shampoo. As I mentioned, dandruff is an interplay. You have a fungus called Malassezia which induces more dandruff. So you have a lot of antifungal components of your dandruff shampoos. You have ketoconazole, zinc pyrithione, selenium sulfide based shampoos. You can choose any one of them. Many of them are available even over the counter. The anti-dandruff shampoo has to be applied nicely on the scalp, rubbed into the scalp and applied for at least 5 to 7 minutes before washing it off. The most common question that I get about anti-dandruff shampoos is, do I use it regularly? Yes, you have to, especially when your dandruff is very active. Can I use it daily? If not daily, at least alternate days. Do I use this anti-dandruff shampoo on the hair? So ideally, anti-dandruff shampoo components are quite drying. I would recommend using 2 shampoos in females. The anti-dandruff shampoo on the scalp and your normal regular shampoo on the hair length. Can I use any home remedies like lemon, curd for the dandruff? None of them have been proven scientifically. So I would recommend sticking to your common dandruff shampoos, anti-dandruff shampoos. Now the next most common thing is, will my dandruff be cured? No, it is not curable, but it can be definitely kept under control. Always remember, there are much more severe versions of dandruff. The next most common disease that we see in our clinical practice is what we call the seborrheic dermatitis. It is like you can imagine as the elder brother of dandruff. Always remember, seborrheic dermatitis, even your scalp psoriasis, needs medical line of management. You cannot take treatment for this at home. What are the other options for your anti-dandruff? What are the other options for dandruff? So you can have anti-dandruff lotions which can be applied overnight. These are medical grade, again will be prescribed by your dermatologist. You can also take oral tablets at times to keep this dandruff under control. Is itching a good idea when you have dandruff? Not really. So if you're very itchy, you should wash your hair that very day. Now what about oiling of scalp? So if you have excessive dandruff, very red scalp, oiling may not be a great idea as it may activate the fungal species. But if you have very dry, sensitive scalp, you definitely need to use oil or scalp lotions to soothe that scalp, to hydrate that scalp. You have to regularly use these shampoos. Daily if your flakes are very sticky and very large, and alternate days at least when the dandruff is very active or it's very hot and itchy. If the dandruff is not curable with the shampoo, you should visit a dermatologist and take options of anti-dandruff lotions and oral medicines. Well, the dandruff may stay for a very long time, sometimes for the rest of your life, but always remember dandruff can be very easily controlled and it's a very common disease, so please do not worry. Thank you.